Mr. President, I come to the floor today, just as I have many times before, to stop another right-wing attack on Title X funding and to defend access to health care for millions of women. Not even a week has passed since the American people successfully beat back Republican efforts to repeal the Affordable Care Act and give insurance companies permission to charge women higher premiums simply because of their gender. Yet apparently, less than a week is not too soon for Republicans to launch yet another attack on women's access to health care. This morning, my Republican colleagues needed the Vice President of the United States to come to Capitol Hill and cast a vote to overturn protections for 4 million patients served by Title X funded health centers every year. For many low-income women, Title X funding is the lifeline that ensures their access to birth control, testing for sexually transmitted infections, cancer screenings, and other basic health services. In fact, 85% of the people served by family planning centers like Planned Parenthood have incomes below 200% of the federal poverty level. Approximately 20% of these patients identify as Latina, and approximately 14% identify as Black. In 2015 alone, Title X funded nearly 800,000 Pap tests, breast exams to 1 million women, nearly 5 million tests for STIs, and 1 million HIV tests. Title X did not pay for a single abortion. Indeed, no federal funding goes to abortion-related care. And indeed, for every dollar that Title X funding spent, we saved about $4 and prevented nearly 2 million unintended pregnancies per year. Family planning services at New Jersey's Title X funded health centers helped prevent 20,500 unintended pregnancies in 2014, which would have likely resulted in 10,000 unintended births and 7,400 abortions. Without public-funded family planning, the number of unintended pregnancies in New Jersey would be up 25% higher. Title X funding services produce significant cost savings to the federal and state governments. Services provided at Title X supported sites in New Jersey accounted for nearly $232.9 million in such savings in 2010 alone. So I hope that President Trump knows that when my Republican colleagues vote to defund Planned Parenthood, they aren't voting to stop a single abortion. They are voting to defund the family planning care that helps avoid unwanted pregnancies and reduce the need for abortion. A vote to defund Title X is a vote to defund breast cancer exams. A vote to defund Title X is a vote to defund cervical cancer screenings. A vote to defund Title X is a vote to defund testing for sexually transmitted diseases. The American people, those who voted for President Trump, voted for more affordable health care, certainly not less. Now, one of my Republican colleagues has come to the floor to make the case in favor of repealing Title X. Not one. Not one. But if my Republican colleagues prevail in this cynical vote, they'll jeopardize access to affordable family planning services. They'll force many health centers to stop providing care to Title X patients. They'll leave doctors, nurses, and other health providers working on the front lines to abandon those who need them the most. I, for one, refuse to allow the GOP to pander to the extreme elements of their party and in doing so limit a woman's access to affordable, accessible health care. This vote is about every one of our sisters, our daughters, our grandchildren. This vote is about women across this country, and I don't understand how we can take away their access to the health care they so critically need. With that, Mr. President, I yield the floor.
Senator from Washington.